Hello, my name is Melanie Leon. I'm going to be doing today's health assessment. So I'm going to start by doing some hand hygiene and washing my hands. It's nice to meet you. Can I go ahead and get your name and your date of birth?
Sandra Rivas, 1178.
Perfect. Can I also get the month? Do you know what month we're in?
May
And do you know what year?
2025.
Do you know who our president is?
Donald Trump.
And do you know how you got here today?
I drove here.
Perfect. So patient is ANO times 4. She's alert to person, date, time, and place. She's verbal. Her speech is clear. She has good hygiene. She's well nourished. Her sexual development is appropriate for age. She's an adult female. Next, I'm going to be moving on and doing your HEENT assessment. So I'm going to start by looking at her hair. So her hair is black, it's coarse, it's long, it's evenly distributed. There's no alopecia, no redness, or dandruff present. I'm going to be looking at her facial features. So her eyebrows, her eyelashes, and eyelids have no abnormalities. The hair is dispersed evenly on her face. There's no other facial hair present. Next, I'm going to be going ahead and looking at the symmetry of her face. So her eyes, nose, and mouth are symmetrical. Her lips are pink. They're moist. There's no fissures or lesions. I'm going to be next looking at your ears. So I'm just going to move your hair. Okay, so the external auditory canal, the skin bilaterally is intact. There's no redness, no swelling, and no discharge. I'm going to go ahead and just palpate your ears. Let me know if you have any pain. Any pain?
No pain.
Perfect. So there's no pain on the tragus or auricle of the ears. I'm going to have you go ahead and cover one ear. I'm going to move over here. I'm going to whisper a word. Can you say it back to me?
Cat.
And I'm going to do the other side. Can you go ahead and cover?
Dog. Dog.
Perfect. So auditory acuity is intact by the whisper test. I'm next going to be starting by palpating. I'm going to palpate your head. Please let me know if you have any pain. Any pain?
No pain.
Okay, so no pain on palpation of the scalp. There's no alopecia or no lesions present or tenderness. I'm next going to be looking at the eyes. So, I'm sorry, I'm going to be actually palpating your sinuses. So I'm going to be touching your face. Let me know if you have any pain. Any pain?
No pain.
Any pain?
No pain.
Any pain here?
No pain.
And any pain here?
No pain.
Okay, so the frontal sinuses, ethmoid sinuses, and sphenoid sinuses are all non-tender to palpation. Same with the lacrimal gland and the lacrimal puncti are intact with no pain on palpation. I'm going to be palpating now your temporal artery. Anything?
No pain.
And your TMJ. Can I have you go ahead and open your mouth? Close. Side to side with your jaw. And front and back. Okay, perfect. And no pain there?
No pain.
So there's no pain on the TMJ, no pain on the carotid artery. The temporal artery. No crepitus on the TMJ. Next, I'm going to be palpating your lymph nodes, okay? So preauricle, postauricle, tonsillar, submandibular, submental, occipital, anterior clavicle. Anterior cervical, posterior cervical, and supraclavicular. So no lymph node apathy present. There's no pain, tenderness, or swelling of the lymph nodes. Next, I'm going to be moving on to your eyes, okay? So can you go ahead and I'm going to have you read this line here for me.
DHJBS.
Perfect. So on the Snellen's chart, visual acuity is 20/20. I'm next going to be moving on to looking at the actual eye. So the sclera is white. I'm going to pull down just a bit. Conjunctiva is pink. I'm going to be shining my light in your eyes, okay? I'm going to be placing my hand here. Perfect. Perfect. Can you go ahead and stare at this? Don't move your head and just follow with your eyes. And stay here, follow with your eyes. Perfect. So can you go ahead and raise your eyebrows? Can you frown? And can you smile? Okay, go ahead and close your eyes. Can you feel this?
Yes.
And can you feel this? Yes. Perfect. So cranial nerve number 5 and 7 are intact, as well as 2, 3, 4, and 6. I'm going to, and then pupils are round and reactive to light equally. Their pupils about 5 millimeters. It constricts to about 4 millimeters with light. I'm going to be moving on to your nose now. Can I have you go ahead and cover one nostril and breathe in? And the other? Same thing. Perfect. I'm going to have you tilt your head up. I'm going to be looking in your nose. Okay, can I have you close your eyes for me? And take a sniff. What do you smell?
Alcohol.
Perfect. So the nares are patent bilaterally. The septum has no deviation. It is midline. There is no discharge or redness present on the bilateral nares. Olfactory nerve number 1 is intact. The cranial nerve number 1 is intact. Olfactory. Next, I'm going to be moving on to your mouth. So can I have you go ahead and open your mouth for me? Okay, I'm going to have you stick your tongue out. I'm going to press down. You're going to say, ah, ah. Okay, can you push your tongue against the tongue blade? And on the other side. And can you curl your tongue up? Perfect. Okay, and I'm going to check your gums really quick. Go ahead and just relax. Perfect. Okay, so the oral mucosa is pink. There's no lesions. It's moist. I can see Stetton's ducts on the oral mucosa. Underneath the tongue, I can see Wharton's ducts. Her tongue is midline. There's good strength, the good strength resistance, good movement of the tongue, and the skin of the tongue is pink with no fissures, cracks, or lesions, and it's moist. I can see her posterior pharynx. The posterior pharynx is intact with no redness or swelling. Bilateral tonsils are intact with no redness or swelling. Her teeth are white. They're straight. There's no visible caries. There's no missing teeth. And her gums are free of any type of gum disease. I'm going to be placing my hand on your trachea now. I'm going to push and you're going to swallow. Swallow. And last time. Okay, and here. Perfect. Okay, so trachea is midline, cranial nerve 9, 10, 11, and 12 are all intact. I'm going to have you push up. Perfect. The trachea is midline. There's no thyroid enlargement, and she's able to swallow fine. That's going to be concluding my HEENT exam. I'm going to be moving on, so there was no abnormalities there. I'm going to be moving on to the thoracic and the lungs. So I'm going to start by inspection. I don't see any retractions. I don't see any skin abnormalities of the front or the back. Do you have any rashes I should know about? No, perfect. There is no use of accessory muscles, no retractions, no difficulty with the breathing. A and P is 1 to 2. I'm going to be starting by going ahead. I'm going to palpate your costal angle, so I'm going to stand behind you. I'm just going to feel up on your ribs, okay? Any pain?
No.
No? I'm going to place my hands here. Can you take a deep breath in and out? Okay, perfect. And then I'm going to be tapping right here. Let me know if you have any pain.
No pain. No pain.
Perfect. So there's no tenderness on the costal angle, no CVA tenderness. Chest symmetry is equal bilaterally. Chest expansion is symmetrical. I'm going to be starting now by listening to your lungs. So I'm going to start on the back. I'm going to listen to the apices of your lungs. I'm going to move your hair over just a bit, okay? I'm going to be listening to the apices of the lungs on the top, then the mid-scapula for her right middle lobe, and bilateral lower lobes, okay? Go ahead and take a deep breath in and out. 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 Perfect. So lung sounds are clear bilaterally. There's no adventitious breath sounds. I can hear bronchiovesicular sounds on the apices and vesicular sounds heard throughout the rest of the lungs. I'm now going to be moving on to the anterior chest. I'm going to start by placing my stethoscope over your trachea. You're going to be breathing in and out every time I move my stethoscope, okay? Take a deep breath in and out. Okay, perfect. So tracheal sounds are heard over the trachea, bronchiovesicular sounds heard over the apices, and vesicular sounds heard throughout. No adventitious breath sounds, and the lungs are clear bilaterally. So that's going to be concluding my my thoracic and my pulmonary exam. I'm going to be moving on to your cardio exam. Okay, so there was no abnormalities found with the lungs or the thoracic. So next, I'm going to be looking for any signs of JVD. I'm going to go ahead and just check your neck. Okay, no signs of JVD. I'm going to be palpating your carotid artery. Okay, and then I'm going to be listening with my bell. Please let me know if you have, just hold your breath for about 5 seconds, okay? Perfect. Okay, you can go ahead and breathe. So there was no pain on palpation of the carotid artery, no JVD, no bruise heard on the carotid artery as well. I am now going to be placing my hand on the PMI, so that's going to be her fifth intercostal space, left midclavicular line. I'm going to just be placing my hand here. Okay, perfect. Now I'm going to be listening to your heart sounds. I'm just going to go ahead and have you breathe normally. I'm going to listen twice. So I'm going to be identifying my 5 cardiac landmarks. First, second, it's going to be the second intercostal space, right sternal border is going to be your atrium. Okay. Your pulmonic valve is going to be the second intercostal space, left sternal border. And then left sternal border, third intercostal space is going to be your Erb's point. And then your tricuspid is going to be the epigastrum area, so I'm going to place here. And lastly, your mitral valve is going to be where your PMI was, the fifth intercostal space, left midclavicular line. Okay, I'm going to turn my bell over. I'm going to be listening to all those points one more time, okay? Okay, perfect. So heart sounds are regular, rate is normal. There are no rubs, gallops, clicks, or murmurs present. Like I said, there was no bruits heard on the carotid artery, no JVD. So that's going to be concluding my cardiothoracic exam. No abnormalities, everything was within normal limits. I'm going to be moving on to your gastrointestinal. Can I go ahead and have you lay down, please? Perfect. I'm going to be starting by inspection. So the abdomen is flat. There are no aortic pulsations present. I'm going to be moving on to, do you have any rashes? Or any? No, perfect. No. So the skin is intact with no rashes. I'm going to be moving on to auscultation. So I'm going to be listening to all 4 quadrants of the abdomen. Okay, and then I'm going to be using my bell to listen to the aorta. Perfect. Okay, so vowel sounds are present in all 4 quadrants. There are no aortic bruits heard. I'm going to now be moving on to palpation. So I'm going to start with light palpation for any superficial findings and deep palpation for organomegaly. So I'm going to be starting by light. Please let me know if you have any pain.
No pain. No pain. No pain. No pain.
I'm going to be pushing a little deeper now.
No pain. No pain. No. No pain.
Okay, so no pain on palpation. I'm going to next be doing percussing. Okay, so I'm going to just do a light tap. Okay, perfect. So there was no pain on palpation, no pain on percussion. Bowel sounds heard in all 4 quadrants. That's going to be concluding my gastrointestinal exam. I'm going to be now next moving down to the legs. I'm going to be feeling first for the femoral pulses since she's already laying down here. So, okay, femoral pulses felt bilaterally. I'm going to be moving on to the toes, knees, ankles, and hips. So can I have you go ahead and wiggle your toes for me? Okay, I'm going to have you go ahead and push on my feet and push up and push out. Can you just move your perfect. Next, I'm going to have you bend your knees just slightly. I'm going to move your knees just a bit. Okay, and then push up and push down. Perfect. Any pain on your toes? Any pain on your knees? No. Any pain on the ankles? No. And you can put your legs down. I'm going to feel your hips. Any pain on your hips? No. Can you lift your legs straight up, both of them, without bending your knees? Go ahead and push. And push up. And can you kick up? Perfect. Go ahead and place them down. I'm going to be next feeling for your pulses, so pedal pulses, posterior pedal, and then underneath your knees for your posterior tibialis. Okay, and then just looking at her legs, there's no abnormalities of the skin, no varicosities, hair distribution is even, the skin is appropriate, and no redness or edema present. Her pulses, her pedal pulses, dorsalis pedal pulses, and posterior tibialis and femoral pulses are all present. There was no crepitus, no pain on any of the joints, and equal range of motion on all the joints, as well as no pain with motion, and no crepitus present. And good strength good strength resistance present on all joints. That's going to be concluding my lower extremity exam. I'm going to be moving on to your upper extremity. So can I have you just go ahead and move and sit back here? Perfect. So I'm going to be starting by assessing. The skin is intact. There's no lesions, no abnormalities. The skin color is appropriate. Her arms are warm. And hair distribution is even. I'm going to have just take a look at your fingers. I'm going to be doing the, just checking for capillary refill. Perfect. Capillary refill is brisk. I'm going to have you go ahead and wiggle your fingers and close your hands. Okay. Any pain on these joints?
No.
No? Any pain on the wrist?
No.
Okay. Can I have you squeeze my fingers? Perfect. I am going to have you push up just your wrists and push down just your wrists. And can you move your wrists around? Okay. I'm going to move on to your elbows. Any pain?
No.
Can you push up and push down? And can you just move your elbows around? Perfect. I'm going to move on to your shoulders. Any pain?
No.
Can I have you put your hands straight out? Can you push up and down? And can you put your hands straight back? And can you touch your back? Perfect. Any pain? Perfect. So the shoulders, elbows, wrists, and finger joints are all free of crepitus. There is no pain on palpation, good range of motion, and good strength resistance. I'm not going to be feeling for your pulses, so I'm going to look at both radial pulses, okay, and brachial pulses. Perfect. So radial and brachial pulses are present bilaterally. I'm next going to be moving on to your back, so I'm going to have you stand up for me. I'm going to first be checking, so your spine area, sorry. Any pain?
No pain.
Okay. Can I have you wrap your arms around your chest? And can you move side to side? Okay. I'm going to have you put your hands on your hips, move back and forward, like if you're touching your toes. Any pain?
No pain.
Okay. Next, I'm going to have you walk towards me, but you're going to do toe to heel. Okay. And back? Backwards. Perfect. Okay, go ahead and go back. Can I have you put your legs together, feet close together, and close your eyes? Perfect. Okay, no swing. Go ahead and open. Romberg's test was negative. Her gait was normal. No abnormalities. I'm going to go ahead and have you sit back down. I am going to check this. I'm going to have you close your eyes for me. Put your hand out, both hands. I'm going to draw a number on your palm. Please tell me what number.
1.
And here.
0.
Perfect. So graphesthesia is present bilaterally. Next, I'm going to be saying 3 words. Please remember them. Cat, mouse, dog.
Cat, mouse, dog.
Okay, keep those in mind. When you cross the street, what do you do prior?
You look side to side.
Okay, perfect. Can you repeat this sentence to me? No ifs, ands, or buts.
No ifs, ands, or buts.
Perfect. Do you know what this is here?
It's a light.
Perfect. And what was those 3 words that I had told you at the very beginning?
Cat, mouse, and dog.
Perfect. So short-term memory is intact. Her thought process is coherent. This is going to be concluding my health assessment. Thank you very much.